some hip mobility that you can do after a run or after a workout or even at night if you're having some hip pain. Now this could be hip discomfort to severe pain. It should feel pretty good to go through these exercises, so make sure they're not super painful. And if they are, I would just try not to go through the full range of motion and just try to go halfway through and really focus on your breathing. So let's get started. We are going to start on your back, and you're going to start with your knees bent. I want you to put your hands on your ribs, so you can just place them. I like to place like my thumb around the back of my ribs. And all you're going to focus on is trying to expand your ribs out and in. And as you do this, so you'll inhale, expand out, inhale through your nose. So as you inhale, you'll feel your ribs come out to the side, and I also want you to push your belly up and your back into the ground. So this is 360 breathing. So you're just focusing on basically expanding all parts of your trunk out as you inhale through your nose, exhale through your mouth. My stomach is making noises because I guess I'm hungry, so I apologize. Try not to shrug your shoulders up. 2 more. Last one. Okay, perfect. Now your hands are going to your pelvis. So they were on your ribs, now they're going to your pelvis. All you're going to do here is tuck that pelvis back. So you're pushing your low back into the ground, pulling your pubic bone up, and then rock it all the way forward as far as you can, and rock it all the way back, all the way forward. Keep going here. So we're going to the extremes of that posterior pelvic tilt where you're pushing your low back into the ground, tucking your belly in, and then push that belly out. Bring your low back off the mat. Sorry about the bigger shirt. We're just going with our breath here. Nothing should be painful. Tuck that pelvis back. Might feel a stretch in your lumbar spine, but remember, lumbar spine connects to your pelvis, which is connected to your hips. So it's okay if we're working on low back mobility. 2 more. And last one. Okay, perfect. Now I want you to stay in this position, take your left foot or your left leg, cross it over your right leg, and just let those legs fall to the right. As you do this, keep your left shoulder on the ground and just place your hand on your left ribs and just that gentle pressure. So you're trying to rotate with your hips and your lumbar spine, keeping your thoracic spine facing or not moving as much. So you're just pretty much isolating lumbar spine and hip as you come up, and then you can come back down. Keep that left shoulder on the ground, gentle breathing. Nothing crazy. You can hold the position or come in and out of it. I feel like my voice just cracked. How old am I? All right, we'll do a couple more here. Nothing crazy. If anything, this should feel pretty good. So as you do this, last one here, as you do this, try to keep focusing on that 360 breathing. You'll have less resistance on your left side because it's not on the ground. And now let's switch. So now right leg goes over the left side and drop your legs to the left. Oh, you might feel a pop, that's okay. Should feel pretty good. Again, that hand's on your ribs. And come on. And down. Keep breathing. When my hand's on my rib cage, in this case on the right side, You can add some pressure, pushing your hand down into your rib cage. Just don't make it aggressive. Just give it a little bit of manual pressure if you want a little bit more rotation. But if you don't, hush, tummy. If you don't, that's okay. And last one. Okay, let's go ahead and go onto our stomach into a runner's lunge, which just means you're in a plank position. And I'm just gonna bring my left hand, or my left foot to my left hand. Hold it here. You can sink your hips into it if you'd like, dropping that bottom knee down if you'd like. And then we're gonna go up into a downward dog, keeping that back flat. Weight is now in your palms and in your toes. And then we're gonna bring your right foot in towards your left hand. Breathe into this. And come back. So now we're just going with our breath. And left foot to left hand. Breathe into this. And come up. Things are popping here, but we're okay. There haven't been any yelps. Good. Let's do 2 more. As you do this, try not to push your pelvis forward like so. Try to bring your pelvis straight to the ground. So that's why it really is okay if your back knee is on the ground. You're not modifying the stretch in any way. Last one. Just try not to like push it forward. Try to just drop your pelvis straight down like it's an elevator going to the lobby. Except it will never get all the way down. Okay, go ahead and relax there. I'm gonna face you here. You can put something under your knee if you'd like. Go ahead and bring that left foot out to the side so my foot's on the ground. I'm just gonna put my hands on the ground, tucking my toes behind me as I drop my butt to my heel. You'll feel a stretch in your adductors, and then you'll just breathe and come on up. So if you can see what it looks like from the side, drop back, breathe, and come back up. You can always alternate what your foot is doing. If you want to feel a stretch in more of the front of your shin and just alternate with the big toe, that's fine. Keep breathing. Last one. And let's switch. So other side just comes out. And I like this exercise because you can start to feel like if you're having pain on a hip, one side of your hip, and maybe even tightness, you can start to feel if one of your adductors feels tighter than the other. So make sure you're paying attention to how your body feels during this movement. Focusing on your breath, paying attention to the tension in your adductor and inner thigh. 2 more. Last one. Okay, last exercise here. We're getting into a half kneeling position, so one foot in front of the other, like that half lunge position. I'm gonna start with my right knee on the ground with my foot back. I'm gonna take my right hand and just bend it behind your head, almost like you're stretching your triceps here. And all I want you to do, so you're gonna tuck your pelvis back into that posterior pelvic tilt. So as you do a posterior pelvic tilt, just like what we did on the ground, you're pulling that belly button back and you're kind of like pushing that front of your hip forward. So you'll feel a stretch in your hip flexor. As you do this, take that arm and then just pull your elbow to the side and you'll feel, and you can start to bend to the left. You'll feel that stretch in your hip flexor. Keep breathing. This might be intense, but just keep breathing. it. So tuck your pelvis back, push your hip flexor forward, and then for a little bit more of an intensive a stretch, you can pull that arm over. We'll hold about 10 seconds. It's okay if you feel this down your quad as well. And relax. All right, last side here, same exercise. Tuck your pelvis back. Now left arm goes behind your head as you side bend to the right. Relax. And one more. Side bend. And relax. All right, awesome job. Make sure if you are having hip pain, you're also going through the hip program, use this as a guide for after runs, before you go to sleep, or even when you first wake up, after you've been on your feet for a long time. Use it. I hope it helps, and I'll see you soon.